Hello everyone, welcome to my new video. I'm gonna talk about another disastrous rare disease causing terrible pain and deformities for the sufferer. Imagine whenever you wear clothes, your whole skin is full of blisters and tears. This disastrous pain is something that EB causes for the sufferers every day. Butterfly disease, or epidermolysis bullosa (EB), is a group of genetic or inherited disorders that causes the skin to be fragile and blister and tear easily. Blisters and sores form when clothing rubs against your skin or you bump your skin. Mild cases of the disease usually cause painful blisters on hands, elbows, knees, and feet. However, tears and blisters can appear everywhere on the body. EB symptoms can range from very mild to very severe. In some cases, blisters form inside the body in places such as the mouth, esophagus, other internal organs, or eyes. When the blisters heal, they can cause painful scarring. In severe cases, blisters and scars can harm internal organs and tissues enough to be fatal. EB has four primary subtypes: EB simplex or EBS. EBS is the most common form of EB, and it can range from mild, not very painful, to severe, very painful. Blisters develop in the top layer of a skin, epidermis. The blisters rarely scar after they have healed. Junctional EB or JEB. JEB causes blisters to form in your mouth and airway. It's rare and it can range from moderate, uncomfortable, mild pain to severe. Dystrophic EB or DEB. DEB causes blisters to grow in the middle layer of the skin, dermis. It can range from mild to severe. Kindler syndrome. In Kindler syndrome, blisters can form in all layers of your skin. It's very rare. Healthcare providers diagnose EBS, JEB, and DEB according to affected layers of skin. Kindler syndrome may appear as blisters throughout different layers of the skin.
EB affects me in many more ways than I could ever explain. The activities that can cause blisters on my body are oftentimes things that people take for granted. For example, I get blisters in the inside of my mouth due to eating. Sometimes even showering can be very painful because the water can cause more damage to my skin.
Who does epidermolysis bullosa affect? EB affects everyone. People of all sexes, races, and ethnic backgrounds can have EB. However, you're more likely to have EB if you have a parent with a disorder. How common is epidermolysis bullosa? An estimated 1 in 50,000 people in the United States have EB. Severe cases of EB may cause blisters in eyes, which can result in vision loss. It may result in severe scarring and deformities of skin or muscles, making it difficult to move fingers, hands, feet, and joints. Some people with EB are at an increased risk of developing a type of a skin cancer called squamous cell carcinoma. Death can sometimes occur during infancy due to severe infection, sepsis, breathing problems due to blocked airways, dehydration, and malnutrition. Mild cases of EB aren't fatal. People with severe cases of EB have a life expectancy that ranges from infancy to 30 years of age. What are the symptoms of epidermolysis bullosa? The signs and symptoms of EB depend on the type, and they usually appear when you're a baby or toddler. Some symptoms overlap between the types. Symptoms of EB include blisters on your skin, hands, feet, elbows, and knees, or inside your body. Thickened calluses on the palms of your hands and soles of your feet. Anemia, low levels of red blood cells. Fused or attached fingers or toes. Deformed or thickened fingernails and toenails. Small white bumps on the skin, milia. Difficulty swallowing. Lack of expected growth in an infant. Teeth that don't develop into an expected size. What causes epidermolysis bullosa? A mutation or defect in one of 18 genes causes EB. People with the disorder have a missing or damaged gene that affects a protein used to make collagen. Collagen gives connective tissues like skin their strength and structure. Because of this defect, the epidermis and dermis layers of your skin don't bend together as they normally would. This results in a skin that's fragile and blisters and tears easily. EB is usually an inherited disorder, which means that one parent may have it and pass it down to their children. EB isn't contagious, it's usually an inherited disorder. Doctors diagnose EB with a test called a skin biopsy. In this test, a doctor removes a small skin sample and studies it under a microscope. A genetic test can confirm the type of EB by identifying the defective gene. A prenatal genetic test can confirm if parents are at risk for having a baby with EB. There is no cure for EB, so it may require lifelong care. When possible, a person with EB is usually referred to an EB treatment center. At this center, you'll find specialists from different areas of medicine who have experience with EB. Specialists include pediatricians, dermatologists, pediatric dermatologists, nurses, and psychologists. They can help with the extensive care that a patient with EB often needs. The amount of care a person with EB needs varies. Parents who have a child with mild EB may be able to care for the child without much help once they learn how to treat the wounds and prevent new injuries. More severe EB requires professional medical help. When caring for someone who has EB, treatment usually involves wound care, pain management, preventing new injuries, watching for and treating complications including anemia, cavities and other problems in the mouth, constipation, dehydration, dry skin, excess sweating, eye problem, infection, and malnutrition. Research is underway to better understand the causes of epidermolysis bullosa and seek new treatments and potential cures. Unfortunately, the sufferers don't experience a normal life, and what they go through during their life is unimaginable. Thank you guys for watching the video. Please subscribe to my channel if you really like to know more about different types of diseases.